Good morning, everyone. So, in today's show, we have the guest Dr. Avinash sir. His country is one of the top most gastroenterologists, and he's also a medical educator. Okay. So, you had an extraordinary journey from becoming the surgeon and also to the medical educator. You played such a diverse roles. So, can you enlighten me about your journey and what brought you to this chair?
See, I think when you are working in a public hospital and in a one of the best teaching hospitals in India, I think you are always have to have multiple roles like this. So I began as a surgeon and I continue to as a surgeon, and from surgery I grew into the surgical gastroenterologist and hepatobiliary surgeon. That was one of the journey, but simultaneously you also go through multiple journeys like an education, because you have 200 students along with you with so many postgraduates. So you realize that there is a need for growing into that teaching field, pedagogic techniques also. Along that, you also have to learn about managing a hospital, managing a ward. So you go multi diversity. I think we normally grow like this. So in a public institution, there is always a growth. So that is the reason I grew from this. But fortunately for me, I got many opportunities at the national and international level. So I could grow much more than in a public hospital, also much more than what was expected.
Sir, as a director of a Hinduja hospital, how does the government influences the healthcare sector in the
Frank,
country?
in a public sector, if you really see today, our government does not really give so much of funding for the healthcare. It's not so much. But however, in India, if you find there is a huge growth of healthcare over last few years. It's not the initially before 80s or 90s, it was only public healthcare. But after 80s now, there is a lot of growth of private healthcare sectors, private medical institutions which have really come up, and therefore the quality of healthcare now is fairly as good as many Western countries. So government probably gives you guidelines, but the healthcare system has to mold itself to give the best care. I mean, government gives many, like say, it gives the basic public health structure, and it also gives the schemes like Ayushman Bharat, insurance sector for the poor and needy. But for a middle class and the private systems do continue to do work. It gives facilities. I'm sure the government gave little facilities, but over a period of time, the healthcare scenario in our government, if you really see, is it gives an environment for which we can really grow.
So, what are the latest advancement in the surgical field that patients can enroll, sir?
I think the major change which came into the surgical environment all over was minimal invasive surgery, from large incisions to the smaller surgeries in practically in every field, whether it was general surgery, hepatobiliary surgery, ENT, and ophthalmology. What the technology brought a lot of change into the whole system. Because of the technology, we find there is a lot of reduced pain to the patients, early recovery, which has really come. Now, initially it was thought a very costly technology, but now I think laparoscopic surgery is done so commonly in most of the time. Then you will also find that the things like, say, we have seen in our own career, ultrasound, CT, MRI, PET CT, and the newer diagnostic machines which have come, the new techniques and advancements into the drugs, they have really made some of the surgical as well as the medical diseases completely changed its parameter. For example, leukemias, means once upon a time had 80%, 90% mortality. Today we see most of the patients of leukemia uh, are recovered and they continue to live with bone marrow transplants and various drugs. So there's a complete change into this. In surgery also, large surgeries and some of the cancers also, we have seen good prognosis with early surgeries, and which we really do. And those surgeries which once upon a time were thought not possible, like they are now being done very commonly, like liver transplants, lung transplants, heart transplants, major surgeries. So I personally feel technology has made a lot of importance, and some of the newer training systems have made a lot of importance in our surgical healthcare. And I feel that's the way to go, because we are now getting better information preoperatively. We have now good intraoperative guidance, and we have now better postoperative management in ICUs and all, which helps us to make our patients recovery better, and it has definitely improved the outcomes over a period of time.
So, you were the chairman of the COVID Death Analysis Committee, a role that is quite challenging. So, what are the key takeaways in managing the similar healthcare response in the future, sir?
It was a very challenging role because nobody knew what was really going on.
Okay.
And that was the time when we really analyze, say, thousands of deaths which happened not only in Mumbai, but also I was part of the NCDIR committee where we did nationally some part also. So I personally feel the analysis and the wisdom we got through that helped us to save many further deaths. So if you really see, maximum deaths occurred in the early part of this, but then we found out what were the common causes of death, how different methods could reduce, what were the, we tried to compare different places and see what they were doing and can we really replicate it into the other places, profile of the patients who were at a high risk and diagnosing them early and giving them intensive treatment. All these kinds of things and these lessons were very important. And I think in next time, I hope we don't get such COVID kind of a pandemics, but it gets something like this. There are a lot of lessons which we can really learn and see how do we develop hospitals, how do you really reduce mortality in such setups. So these are small things which we learn by analysis, and I think that was a major role which we really did.
So, you have been a major advocate for improving the medical education in India. So, what are the current what are the current scenario that needs to be changed in today's education, sir?
Fine. I think what we are really seeing in currently in India, both at undergraduate and postgraduate level, is a very rapid growth in the numbers. What from the number of students at UG, which were around 50, 35, 40, 50,000, now suddenly become 1,08,000. Postgraduates, which were 30,000, have become 60,000. Now, when the numbers increase, we have to all get concerned about the quality of education, the quality of output. Are we creating people who are competent? I think that was the major question. So we need to have more kind of an vigilance and on these aspects. At the same time, we need to, all of us need to ensure that all the graduates who are being coming to the medical field now get a proper training and they become safe kind of a physicians for the population. You know, our aim is not only that they pass the exam, but they are competent enough so that they give the healthcare safely and they do not cause any damage to the community. And I think currently what we really need to do is that we intensify the quality of the education, see that whatever the newer elements which are coming in education and into the field, whether it's a surgery, medicine, healthcare, that technology advances, whatever have improved, can be given the best possible to our patients at the same time by bringing this. So I think this is a challenge of our healthcare and education at this stage. So if you are able to see and cope up with this number system, there are so many medical colleges here which are still struggling to increase the quality. So I think this is where we need to, whatever methods we do, whether it's a peer support or whether government support or their inside, we need to strengthen these all systems so that the output which comes from them is a competent output and a safe output.
Sir, as a leader in a surgical gastroenterologist, what are the emerging trends that you're most excited about?
Kind of surgeries which when I was a student we were not able to do, now we are able to do so easily with laparoscopy, minimal invasive, robotic surgeries, and the kind of an understanding I have about these diseases and the way we conduct this. And we send patients home early, we make them very happy. The complex diseases which once upon a time we used to think about they're inoperable, now we give them chemotherapy and we try to make them operable and operate them. So we try to help patients with multimodality treatment, with a team of doctors, with the use of technology. and it's a ever changing field, and there's a newer and newer things are coming. So I think we need to really look at them more carefully, see their safety, and then try to bring into our patients without any ethical issues. So I think this is where I think feels very exciting. There's a rapid change which is happening. The newer techniques are becoming more safer and good for the patients. So we need to really see and adopt them carefully so that the patients are benefited out of this kind of a development. And that is what is exciting. Even after say 50 years of practice, I feel 40 to 50, 45 years of practice, I still feel that I have to learn more, and there's a new thing which is coming and I have to advance myself. And this kind of an enthusiasm and kind of a knowledge which is coming up, and I think makes me happy that I still active in my life.
Sir, outside medicine, you are passionate in photography and trekking. You have explored Himalayas and Antarctica. So, how did that help you in your professional life, sir?
I think we all of us are work beyond our capacity. I always feel from morning, early morning to late night, we are busy all the time. We take our own stresses, and that's where I feel these kind of outings or breaks help you. They re-energize you. I think it's not just going to one particular place. It's spending time with nature or spending time in a free air plus energizing yourself with your peers. I think that helps you to, when you come back, you are so re-energized that you work more enthusiastically, I think so. Otherwise, in a routine thing, sometimes you may get bored or you may get fatigued. There's something called as a compassion fatigue and fatigue you get. Now, all that can be avoided if you have a break like this and you go and visit like this once in Himalayas or Antarctica or Arctic Circle or somewhere. I personally feel when you come back, you are energized for whole year. And I think that's the beauty of this whole kind of trips. And you not only you enjoy the trips, your photography and the views, but also you re-energize yourself. I think it's like a rejuvenate your life, and that is very important in your life. Otherwise, when you are busy with patients and seeing their misery, and then you see death and life every day, sometimes you can get compassion fatigue. So you can to break over that compassion fatigue. I think we need to break yourself and do this.
So, you're being named as 2% of the top scientists by the Stanford University. What does this honor mean to you, and how do you see the medical education evolving in the India and also across the globally?
Sure. I think some of these honors come because you have been continuously working in the academic field. I think it is so many years of your work you do, they automatically you get included. So I think it's okay. I mean, it's just a recognition.
So, it's a huge
But
recognition, sir.
what I would like to really see that medical education in India is growing very fast, and maybe in 20 years later, India is the one who is likely to provide healthcare to the whole world, because the world, many countries you find world population is aging, and the newer generations are not interested in the healthcare. Their services are limited. They need more healthcare workers. The India is producing doctors and nurses not only for India but for the whole world. So I feel we should ensure the quality of the education so that ultimately it is we are providing the quality healthcare to the whole world. And therefore, that is our responsibility, I think, as a teacher and as an educator, that we invest now in our this generation so that we can provide the good healthcare in the future generation.
Thank you, sir, for
Thank you. Sure.
sharing your extensive
Sure.
knowledge and your life experiences. Your journey is truly inspiring, from being a top gastroenterologist of the country and to also trekking across the Himalayas and Antarctica.
Sure.
And your key role as a death COVID analysis. It's truly inspiring, sir. Thank you for all the hard
Sure.
work that you put
Thank you.
up into
Thank
the
you so
country,
much.
sir.
Thank you so much.